Hey guys, welcome back to my channel. As you can see, my setup is a little bit different today. We're starting a new series called Ask a Trainer. Today we're going to be diving into how to fix low back pain when it's specifically associated with core exercises. There are many things that cause lower back pain, but I'm not here to talk about that on a broad spectrum because I'm not a doctor. I am, however, a personal trainer. This means that I can give you helpful tips and tricks to help you fix your form in core exercises. This will not only help you strengthen your core more effectively, but it will help provide some lower back pain relief whilst performing your core exercises. Before we dive into this topic, I would really appreciate it if you could take a second to give me a thumbs up and also subscribe to my channel. These seem like really little actions, but they mean the world to me as they help my channel grow and they allow me to continue to provide free content for you guys. The biggest issue I run into with my clients who have no previous lower back injury, who experience low back pain during their core exercises, is poor pelvic positioning. The way that the specific abdominal muscles that we're talking about today function is to either crunch your hips towards your rib cage or vice versa, bringing your rib cage down towards your hips. Now, when your pelvis is in this unideal position, it's going to be a lot harder for your core muscles to activate properly as they're going to be in an elongated position. And it's also going to put more pressure into your lower back. There's a few different pelvis positions that you can get into. You have your anterior pelvic tilt. This is where you have more back extension, so more of a curve through that lumbar spine, and is often associated with seeing your butt poked out and then leaning forward, as you can see in the image. You have your neutral spine, which, as you can see, everything is in a much more aligned position than you saw in the anterior pelvic tilt. The last positioning is going to be a posterior pelvic tilt. So this is where your hips are more scooped forward, so your back is going into more flexion here. You see there's a little bit more of a crunch happening through the torso. And this is the position that is actually going to be more ideal for specific core exercises, as it kind of puts you into that crunched position. Now, this position isn't ideal for every single exercise. It's not ideal for walking around or sustaining during day-to-day life, but like every exercise, there's specific form that is involved, and this form will help you take a lot of pressure out of your lower back and then put it into your core. So if we go back to the video that shows that anterior pelvic tilt, you'll see that the abdominal muscles are more elongated. The lower back has a lot more extension in it, which is going to be placing a lot more load through the lower back. And then since the abdominal muscles are so stretched out, they're going to have a harder time activating and working properly. Basically, all of this to say, your lower back is going to be doing a lot more work than necessary, and your abs are going to have a lot harder time pulling and engaging as they need to. Now, I'm going to show you how this practically applies in planking exercises and also exercises where you're lying down on your back. So a lot of the common plank form that you're going to see on IG or around the gym is going to look something like this. So what you're going to see here is that anterior pelvic tilt. A lot of rounding through that lower back. That butt is popped up into the air, and you might notice that torso is pretty elongated. So now if you tuck your pelvis in, passing that neutral spine position and more into that posterior pelvic tilt, you'll see a lot of that curvature in the lower back has been eliminated, and the core is now in that crunched position. If you try this yourself, you might find it actually makes your plank a little bit harder to do because you're activating your muscles in a way that they're not used to being activated, which is the correct way. The exact same thing applies with exercises while you're lying down on your back. Now you can see with my positioning, there is quite a bit of an anterior pelvic tilt happening. You can actually see my lower back coming off of the ground. It's important to note, depending on your body fat percentage, your lower back might still feel like it's on the ground, but that doesn't mean that your spine is, and you might actually still be in that anterior pelvic tilt. So this is just like in the plank, where your back is in more flexion. You're going to be doing a lot more work through your lower back here, and that core is going to be elongated. So when you're doing exercises like flutter kicks, you're lifting your legs up and down, you're going to be working more through your hip flexors and your lower back than your core. Now, if you shift into more of a posterior pelvic tilt, really shoving that spine into the ground and scooping your butt up, it's going to help you eliminate that arched lower back, and it's going to help you tighten into your core more. Now, you may find, depending on your core conditioning, that as you lower your legs closer to the ground, your lower back might pump up and start arching again. And this is just where your core starts to tap out. You lack the stability through this range. So in order to keep it in your core, try to stop at that point right before your back starts to come up, and then pull your legs back up towards your body. It's important to work within your own body's range, but it's also going to be important as you develop more core strength to tap into those ranges that we've been leaving out. So as your core gets stronger, try to go a little lower with your legs while keeping that lower back in the ground. That way you can increase your range of motion. This will help you increase your mobility, and it will help you also tap into more core strength. I also want to point out that if you place your hands under your lower back while you're doing your core exercises, you're only furthering that anterior pelvic tilt. You're just encouraging that lower spine to be arched up into that back extension. If you want to place your hands anywhere, reach down as low as you can under your glutes, and that will kind of help cradle your back and your core into place. All right, guys, those are my tips and tricks. I hope you guys liked the more educational style content in the Ask a Trainer series. Let me know in the comments down below if you feel called out for your form. Let me know if you tried any of these tips and they helped alleviate the lower back pain that you experience while working out your abdominal muscles. And then, of course, please don't forget to hit like and subscribe. It truly does mean a lot to me, as it does help my channel grow. All right, guys, until next time. Bye!